The flu is surging in the US, and CDC estimates that there have been over 7.5 million cases so far. We're also still likely weeks away from the actual peak, as people head back to school, daycare, and work this week. Today, as a former CDC contracted scientist, I'm breaking down everything you actually need to know about this year's flu season. The stats, the science, how effective the flu shot is this year. Does the flu test that you grab at the pharmacy actually work? And how do they choose what goes into the flu shot in the first place? I also want to make this personal. As a mom with a toddler and infant, married to a physician, I'm going to chat about how we're thinking about and managing this year's flu season in our own household. So grab a cozy drink, settle into your morning or evening commute, and let's dive in. Hey everyone, and welcome to Transmissible, a public health podcast. I am your host, Jessica Stahl, and I have spent most of my career as a contractor with the Centers for Disease Control and Prevention. First, working with dangerous and rare pathogens in the laboratory, then traveling internationally with CDC to train scientists in rare bacteria identification. I then worked on the emergency COVID-19 response on the laboratory and testing task force, working on comms and with the media. I also have my MPH from UAB with a concentration in epidemiology. And welcome to my podcast. This is my passion project. It's where we cover every public health topic under the sun, or we plan to, from historic outbreaks, dangerous diseases, leaning more into the infectious diseases, but also touching on topics such as public health challenges during wartime, during natural disasters. My hurricane episode is one of my most popular ones I've recorded to date. Preeclampsia, extreme morning sickness, hyperemesis. That one was a personal one for me. That one hit close to home because I was recording it as I had it. Phototherapy for newborns. We've touched on topics under, the umbrella of germ theory and historic topics like that. I recently did an episode on vaccines and autism that is also getting quite a few listens. And we just have a good time here. Basically, I deep dive and then I come on here and I present it to you guys. I recently added the video aspect to this podcast. So you might be now watching on YouTube. My light is like a little bit too bright. I feel like it's blinding a little. Here we go. Or Spotify video, or, Apple Podcasts isn't quite there yet, but that still has the audio. And yeah, thank you for listening. If you are listening to Transmissible, you are joining a community of really smart, fun, nice people from over 49 different countries. And I am just so excited that you are here. Today, we are talking about a topic that is timely. It is causing a lot of fear and anxiety around the world. We are going to specifically be honing in on the US, but as you will pick up as we go through the episode, it pertains to flu in general. And just, if you're listening from a different country, definitely still tune in. I think you will learn a lot about what is going on. And and then like I said in the intro, at the end, I'm going to kind of talk about what we're doing in our own household, how we are looking at flu, how we are, mitigating issues and facing stuff like preschool and, pre-K. My husband works in a hospital. What is he doing at work to lower the risk of bringing flu home? What am I doing in my personal and professional life? How are we handling, getting on a plane? I was on a plane last week. So definitely tune in for that, especially if you are a parent and you are concerned about the details and ins and outs of day-to-day, how to handle flu right now. I just know it's a topic that is causing a lot of anxiety. It is also quite the hot topic in the media. So it is getting a lot of clickbait as well, whether it's the media or social media. So I want to give you guys the facts. I want you to have the tools to help prevent flu, tools, what happens if you get it, and just how to look at it with evidence-based knowledge and not clickbait fear. So without further ado, let's just jump right in. I have my microphone in a different spot, and I am really, fingers crossed, hoping that at the end of this, I don't review it and see that it wasn't picking up the sound correctly. I did a couple practice runs and it was fine, but it just makes me nervous that, it's usually here and now it's right here. But anyways, let's just dive in. So let's talk about what is happening right now in the US during this year's flu season. Seasonal influenza activity is elevated. You probably already know that, and is continuing to increase across the country, with sustained activity across multiple surveillance indicators in every single US region. But before we jump into the statistics, I want to give an overview of flu itself, influenza. I'm going to be using influenza and flu interchangeably. They mean the same thing. How it spreads, when it spreads, the symptoms, what is flu A, what is flu B? Let's talk about that really quick, just so we're all on the same page before we get into the current statistics. So flu A or influenza A viruses can be broken down into subtypes depending on the genes that make up the surface proteins. Over the course of a flu season, different types, A and B, and subtypes, only for A, of flu circulate and cause illness. Flu A and flu B viruses are responsible for seasonal flu epidemics that is commonly known as the flu season. We get this every year. The signs and symptoms of flu can include fever, the feeling of being feverish or chills, cough, sore throat, runny and stuffy nose, muscles or body aches, headaches and fatigue or tiredness. Cold symptoms are usually much milder than the symptoms of flu. People with colds are more likely to have a runny or stuffy nose. That's another thing, is that you start to get sick and you're like, is this the flu or is this a cold? Flu is generally more severe than a cold. A 2018 CDC study published in Clinical of Infectious Diseases looked at the percentages of the U.S. population who get sick with the flu using two different methods and compared the findings. Both methods had similar findings, which suggests that on average, about 8% of the U.S. population gets sick from flu each season, with a range of between 3% and 11% depending on the season. The same CID study found that children are most likely to get sick from flu and that people 65 or older are least likely to get sick from flu. They found that children younger than 18 are more than twice as likely to develop a symptomatic influenza virus infection than adults 65 and older. Most experts believe that flu viruses spread mainly by tiny droplets made on people with flu, cough, sneeze, or talk. These droplets land in the mouth or noses of people who are nearby. Less often, a person might get flu by touching a surface or objects that the flu virus is on, and then touching their own mouth, nose, or possibly their eyes. I did a Disease Detective Word of the Week episode a couple months ago titled Fomite. Go check that one out. That is right in that alley. You may, doing a little promo. You may be able to spread flu to someone else even before you know you are sick, as well as when you are sick with symptoms. People with flu are contagious during the first 3 days of their illness. Some otherwise healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. So you're most contagious in those first 3 days, but it can go, up to 7 days after becoming sick and a day before you even feel the symptoms. So you're hanging out with someone, they feel fine, and they could still be spreading the flu. Some people, including young children and people with weakened immune systems, may be contagious for longer periods of time. The time from when a person is exposed and infected with the flu to when symptoms begin is about 2 days, but can range from anywhere from 1 to 4 days as well. So that's kind of an overview of what the flu is. It's this viral infection. It can have severe symptoms, and it can, in worst cases, lead to death. So far this season, CDC estimates that there have been at least 7.5 million illnesses, 81,000 hospitalizations, and 3,100 deaths from the flu, and tragically, 5 influenza-associated pediatric deaths were reported to CDC this week, bringing the total for the 2025 to 2026 season to 8 pediatric deaths so far. These are getting a lot of media attention. They're very, very sad. They're tragic. Pediatric deaths are investigated on an individual basis. For example, if a 65-year-old man gets the flu and dies, it doesn't get an all hands on deck investigation, whereas a pediatric death does. That is one of the reasons why you see it highlighted so much in the media. In addition to being tragic and sad, there's just a lot more information around that individual case. The good news is that severity indicators are still low. So technically, as of today when I'm recording this, the night of January 3rd, it is not a severe flu season. CDC classifies flu seasons using 3 indicators for severity. Hospitalization rate is an example, that's one of them. And flu activity is not at this severe level, but it is expected to continue for quite a few more weeks. So when you're seeing these headlines that are like, extreme superbug, ripping through America. I've seen just crazy headlines. The season is elevated. There are a lot of cases, but the severity indicator is still low. It is not a severe flu season yet, technically. When we look at the viruses themselves, influenza A, H3N2 is clearly dominant this season. Last week, the public health labs reported that the samples that they were testing, 90% were influenza A, with H3N2 accounting for nearly all of the subtyped cases. When CDC took a closer look genetically, nearly 90% of the H3N2 samples that were collected since late September belong to what is called, and you're seeing this in the media right now, is Subclade K. So Subclade K is getting a lot of media hype, and we're going to talk about that further. Regionally, flu activity is rising everywhere, but not evenly. Region 8, which includes Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming, currently has the highest test positivity rate in the country at nearly 35%. That's where I am. I'm recording here in Denver, so I am sitting in the highest region. Meanwhile, Region 9, which has Arizona, California, Hawaii, and some others, has the lowest positivity rate at just over 10%. So you can see, even though they're kind of close to each other, very different positivity rates. And across all the regions, H3N2 remains the dominant strain with Subclade K. Okay, I paused it. I'm back. I had to move my microphone. It was stressing me out that the sound wasn't coming through crisply enough, and I do think it needed to be in the front. So if it was a little fuzzy before that, sorry about that, but I am back. So, okay, we've covered the regions where it's spiking. We've talked about the dominant strain that's circulating, but let's pull back a little bit. So I want to explain what happens before the US's flu season, how we get our flu shot, and how public health professionals prepare for the flu season ahead with what has happened previously in the Southern Hemisphere. So every year, there's a lot of behind the scenes work that goes into deciding what goes into the flu shot. And it starts far earlier than people realize. The World Health Organization, or WHO, meets twice a year, once in February and once in September, to review flu activity from around the world and recommend which strain should be included in the seasonal flu vaccine. Flu doesn't hit everywhere at the same time. Countries like Australia have their flu season months before we do here in the US, which gives us an early look into which strains are circulating and sometimes how intense the season might be. And in Australia, the 2025 flu season was more severe than their 2024 season. Now, that doesn't guarantee anything, but historically, when they have a tougher season, it raises the possibility that here in the US, we could have a tougher season. So because their last season was a little bit tougher, more severe, it means that our 2025 to 2026 season could be more severe. Okay, it's not a guarantee though. Interestingly, in the Southern Hemisphere, H1N1 dominated earlier in the season, which with H3, remember this is flu A, influenza A, H3N2, Subclade K rising right at the end. So when we looked at their flu season, we were seeing a heavy H1N1 dominant season, and then right at the end, they got this uptick of H3N2, and that is now what we are seeing in our season. When we look at the early data from the UK and Japan, H3N2 Subclade K showed up in 90% of their flu samples, which closely mirrors what we are seeing here in the US. So H1N1, although heavy in the Australian season, is, kind of out, and now it's the H3N2 Subclade K. So that's interesting. What does that tell us? What does that tell us about the flu shot? Did we make this flu shot based on Australia's season, and then that's not what's happening here? Should I not get the flu shot? Did the flu shot that I did get not work? Let's talk about that. So all flu vaccines in the 2025 to 2026 season will be trivalent, which means that they include 3 vaccine viruses. This means they are formulated to protect against 3 main seasonal influenza type A and type B viruses. And the ones that they are this year are influenza A, H1N1, influenza A, H3N2, ding ding, and influenza B Victoria lineage virus. So this formulation reflects what has been circulating globally. It reflects the Southern Hemisphere. It reflects what we're seeing now. And about 130 million doses of flu vaccine have already been distributed in the US, and CDC continues to recommend this vaccination for everyone 6 months or older who has not received it yet. So to understand how well vaccines work, it is important to distinguish between these two phrases that get thrown a lot in scientific jargon, but also, if you're reading a news article. So there's vaccine efficacy and there's vaccine effectiveness. Vaccine efficacy is measured in controlled clinical trials. It's based on how many people who got vaccinated developed the outcome of interest. That can be disease, that can be hospitalization, that can be death, compared to how many people who got the placebo or the dummy vaccine developed the same outcome. So vaccine efficacy tells us how much the vaccine lowers the risk of the outcome, going to the hospital, getting sick in general, in a trial setting. Let me give you an example of this. If a vaccine has an efficacy rate of 80%, it means that the vaccinated group had an 80% lower risk of developing the disease or whatever the outcome is, hospitalization, than the unvaccinated group, those who received the placebo or the dummy vaccine. That was people who in this trial got a vaccine. They did not know if that was the real vaccine or if that was like a little bit of saline or whatever. And the people who got the dummy vaccine are considered the unvaccinated group, and those are the two groups that they're measuring. That's vaccine efficacy. Vaccine effectiveness is similar, but it instead refers to how well the vaccine works in the real world outside of the clinical trials. Vaccine effectiveness can differ from vaccine efficacy because we can't predict exactly how effective vaccination will be for a much bigger and more variable population getting vaccinated in actual real life conditions. So we are looking at the vaccine effectiveness of this year's flu shot with the strains that are circulating right now. And in the UK season, vaccine effectiveness data are actually very encouraging, especially for children. Among children and adolescents ages 2 to 17, vaccine effectiveness against emergency department visits and hospitalization from the flu circulating this year right now in the UK was high, around 72 to 75%. In adults, overall effectiveness was more moderate, around 32 to 39%, which is typical for flu vaccines. So the flu vaccine for kids is about 72 to 75% effective. That is pretty good, right? That is still encouraging. That means if your kids got the flu shot, they are seeing an advantage from that. It means if you have not gotten your kids vaccinated yet, it is still a good idea. CDC is still recommending it. Adults aged 18 to 64 saw higher protection against the flu, around 60%, while adults 65 and older saw effectiveness similar to overall vaccination. So this is fine. You're going to see a lot of headlines. They're saying the flu shot mismatched. That's because Subclade K came later in the season. That wasn't something they were specifically targeting when they were creating the flu shot, but the flu shot is still showing to be effective. The vaccine effectiveness is still pretty good. So I think this is very, very encouraging. So another thing to point out, that we are talking about severe illness. This is hospitalization and emergency department visits from the flu. So that is still pretty good, right? So if you're seeing stuff that says, you shouldn't have got the flu shot or don't get the flu shot, it doesn't work this year, that is just not true. So in terms of the flu test, you can walk into Walmart, Walgreens, CVS, King Super, Fred Meyer, wherever you're living, and get, these flu tests. Sometimes they do flu and SARS-CoV-2. Sometimes it's like flu A, flu B. I've seen on, mom groups and just kind of around on the internet, people asking like, does that still catch, Subclade K? Is the test still accurate? And the answer to that is yes, the tests are still accurate. And so you can still go to the store to get an at-home flu test, and those tests work for this flu season. So that is good news. Overall, in our household, I guess kind of segueing into what we're doing this year, this is kind of what we're doing. So obviously this is a topic that I know a lot about. My husband, he's a physician. He knows a lot about it as well. So how are we handling our two vulnerable kids? We have a 3-year-old and a 7-month-old. I have type 1 diabetes, so I am just at a higher risk of severe illness, being hospitalized, stuff like that. My husband works with cancer patients. Cancer patients are also a vulnerable group. So how are we, moving in this scenario? So we have all gotten a flu shot in our household. Myself, my husband, my toddler, my infant gets one next week. You can't get it until you're 6 months or older. And so we're, long story short, with scheduling, we're getting it like literally in 48 hours. We're getting it Monday morning. We are really good about our hand hygiene. It's not just the flu. There's still RSV, there's COVID, there's norovirus. So hand hygiene, I did a whole episode on norovirus, but norovirus is not killed by hand sanitizer. You have to wash your hands. But what we're doing, for example, we're at the grocery store. We're using hand sanitizer when we get into the car before we touch everything in the car. And then when we're getting home, we're washing our hands. We're just being, more intentional about hand hygiene. We are not doing play dates if kids are actively sick, if our kids are sick or if other kids are sick. Now that might sound obvious. To me, that should be obvious. But the longer I'm a parent, the more I realize that is not how everyone operates. People will show up to kid play dates on the absolute verge of death. Like, you shouldn't have come to the play date. You should have gone to the hospital. Like, people will show up to play dates that way with kids who were sick. And I've been to those. I've left those. I was at a mom group meetup thing, and this girl, I think I can tell the story. This girl walks in. She is ghost white. She said, end quote, "The plague has hit their house." It was hard for her to get there because she's so sick. She's throwing up. This was like a while ago, and she was just glad to be there because they've just been so sick, and they were very clearly still sick. And there was probably 7 moms there with little babies. It was like a mom kid play date thing. And I'm sitting there, picture me in that situation. I'm sitting there and I leave. I made up something. I was not bold enough to be like, the real reason. I chickened out, but I left. We left and I didn't get sick. And I believe, if I remember right, other people did get sick. So not going to play dates when kids are sick, and also not showing up if our kids are sick. That is something we do, and I encourage everyone to do that. Something else we're doing, if we're in the grocery store and someone is like, we hear down an aisle, someone is like coughing up a lung, we're not going down that. We're just being kind of smart in the moment. We're going to not choose that aisle, right? If someone's hacking, just stuff like that. But, we're still going to school. My toddler is still going to his part-time preschool. My husband obviously still has to go to work. We're still going out. We're still getting on the airplanes. I got off of an airplane a week ago. We still went on a trip right before Christmas. So we're still operating, somewhat normally, but we have our flu shots. We have our hand hygiene. We're being intentional about, kind of who we're seeing, how we're doing that. And yeah, we're just kind of trying to be smart about it, but still live our lives. We're not too anxious about it. I think I understand, some households have people who have more vulnerable groups in it. I, as a type 1 diabetic, well controlled with my blood sugar, I have a slightly higher risk, but it's not preventing me from going out. This is what we're doing. This is not what you have to do. If you are more cautious, that is totally fine. Do what feels right for your family, but we always say it and my husband and I say, we say follow our gut, but educate our gut. So if you have a really educated and really in tune gut on the topic, you can make real-time decisions, right? You can not go to that play date. You can walk out of that play date, or you can say, we're going to go to this, we're not. So that's kind of my roundabout way, because I'm not keeping my kid home from school. I understand if people want to, we're not at this time. Do you know what I mean? Now, if it got crazy severe, we might. This is what we are doing on January 3rd. That can change a week from now. That could change a month from now. Science is always changing. The data is always changing. Part of quote unquote following the science is, that term has gotten a little bit muddled, but I think part of following the science is being flexible to how it changes and how it would affect your family in different ways. So that is what we're doing. I think being cognizant of mental health and happiness, and I want my kid at the playground and I want him at the birthday party and stuff, while also being smart and using evidence-based tools to help keep our family healthy. I think those can coexist together at the same time. I think you can be smart and you can be still involved. Now that's going to look different. Like I said, it's going to look different. And you guys know, I always say, this is not medical advice. I'm just talking about what I do. You should talk to your doctor about what you do, just for my legalese speaking necessities there that I always throw in there, because the lawsuits scare me a little bit. But that's what we're doing. That is flu right now. This might change. I might do a mid-week update. I'm doing 2 episodes a month, a modern and then a historic. This was my modern, first Monday of the month and then third Monday of the month. If something crazy happens with this flu season, I'll jump on and do a mini episode for an update. But right now, Influenza A, H3N2 is driving this season. The vaccines are working. And while severity remains low for now, this is very much an active flu season. And like I said, each HHS region is elevated. And so it's a flu season worth taking seriously, but I think you can take something seriously without panicking about it. I know that just a lot of people are really anxious about this topic, and I would encourage you just to use all the tools that you can and do what you can, but still try to enjoy your winter. I'm saying a lot. That means it's time to wrap it up. But that's basically the season this episode. I'm going to do a bunch of links. So I'm going to do CDC surveillance page, their in-season severity. That's how it explains how they decide what the severity is. And it also tells you the updated severity. Because if you're listening to this episode 2 weeks from the time I recorded it, the severity level might be different. So check that link and see what it is when you are listening to this. I'm going to link the difference between the flu and a cold, and the clinical signs of the flu, what to do if you get the flu. And what else am I linking? I like to do a lot of links. In the body of these episodes, if you look, I do tons of links. I want everyone to get credit who gives me my info for these. And yeah, I think that's about it. Kind of a quicker episode, more just keeping my listeners in the loop. I want you guys to be in the loop so you can be smart and make good decisions, but also enjoy your winter. Stay cozy, try to enjoy going back to work and back to school, and the beginning of 2026. Hope everyone had a great holiday season, and that we are hitting 2026 hard and taking it by the horns, or whatever all the sayings are, because I think it has the potential to be a really good year. And yeah, I think that is about it. I definitely feel like I'm forgetting something, but I think that's it. I guess my overall thing is I just want it to be known that the flu shot is working pretty darn well for kids. It's working well for everyone, but the kids one's nice. You know what I mean? against emergency department visits and hospitalizations. So if you, like I've seen just people are really anxious about the kids. If you're anxious about the kids, this is not medical advice, talk to your doctor. But I think the flu shot is a great option. We've done it. We are doing it. And yeah, so I guess that's it. I'm kind of rambling now, but I hope everyone has a great week. And like I said, if something changes or something crazy happens, I will jump on and do like a mini episode. But yeah, I think that's it. Thank you guys for listening, and I'll see you next time. Bye.